Hello, Ajit.
Yes. Welcome, Roman.
Um,
Yeah.
I'm very happy about our collaboration on Hotline. I see that you received a lot of patients from all around the world, and we see fantastic results. And you know, it is so not only nice. It's wonderful to know that homeopathy is working, and we have so many interesting and good results with this Ommiccrronn as well. So I would like to start to talk about this last medical fashion, Ommiccrronn. First of all, let us talk about typical clinic picture of Ommiccrronn and our attitude, homeopathic attitude to it.
First thing is that the staggering rise in Omicron cases has brought the whole world to think of the variants, which may be so many in future, we don't know. The whole issue is that with Omicron, homeopathy can be pushed very deeply in the interior of the world. This is basically because this Omicron is like seasonal flu. We homeopaths have been boasting to treat it since 250 years. Our gelsemium has been used since Hanuman, seasonal flu. And we have so much excellent results with Omicron. Of course, we had also results with Delta, with other variants also. But I think we have a very big field of homeopathy today. And every homeopath must exploit the situation now. When it is said that allopathy has very little to offer in viral infections, homeopathy has much to offer. So the first thing very important, what are the common symptoms of Omicron? The scientists have presented 14 symptoms and they are less in intensity. It is mostly limited to the upper respiratory tract, not the lower one. Omicron, therefore, is less dangerous because it doesn't cause the severe lung infection in terms of pneumonia, necrosis, thrombi, emboli, and the lung damage in terms of fibrosis. So naturally, this virus more stays with the throat, posterior nares, palate, trachea. So it is mostly pictured like tracheitis. And therefore, you are able to see much more mucus and the irritation in the throat leading to the cough. So let me enumerate these 14 symptoms. The first symptom is a running nose. Watery, thin, profuse nasal discharge, at least in the initial phase. And the remedy that works at this particular stage, even there is no thirst, is arsenic album. The reason is arsenic album has thin watery discharges. So you have the beginning of the viral infection. There is a viremia, weakness. Weakness is a very strong feature of corona in general. So weakness out of proportion on the first day itself, and the nasal flow, enough for arsenic album to prescribe upon. You can push it for 1 or 2 days. I usually give it in 1 m potency every 3 hours or every 4 hours. And I found that the illness is limited to the upper respiratory. Patient doesn't go deeper, and very soon the patient starts feeling better. So I talk about running nose. The second symptom is headache. This is a matter of concern. In Omicron, the virus infection takes a toll at the level of very severe form of the headache. It could be in the forehead, it could be frontal sinusitis in general, or it could be at the vertex, or the whole head aches very badly. And one of the remedies which I found very useful is simple belladonna. Now, the reason why belladonna is useful, because the patient becomes very sensitive to stimuli, which is characteristic of belladonna. Belladonna comes from the Solanaceae family. In the Solanaceae family, hypersensitivity and congestion of the head, these are the hallmarks. So you have now belladonna, where patient has photophobia, is worse by any stimulus like light, noise. The headache is very severe and throbbing type. The patient feels that the head has become extremely heavy. Even I had a case last week of a homeopath, and I began treating her with Breyonya, with all classical symptoms of Breyonya. She developed fever, dryness of the throat, dryness of the lips with parchment. She had thirst for large quantity at large intervals. So it was a perfect picture of Breyonya. I went 1 m every 2 hours. With 2 doses, she slightly felt better. She had a good sleep. And when she woke up, she found that the head is maddening. So much severe pain, she was literally crying from the pain. I took the totality and gave her belladonna 1 m every 15 minutes and asked her to stop Breyonya. Fourth dose, belladonna stopped the headache. Again, she had the same symptoms of Breyonya, so Breyonya was being continued.
So
So
I would like to ask Ajit. I would like to,
yeah,
because this
yeah,
is
yeah.
this is my experience as well, and I think many other homeopaths see this. I see very frequently these days. One remedy starts, and then we have a very clear picture of another remedy, and then we give this another remedy, and then or it disappeared at all, or it comes back. It comes situation comes back. So my question, according to your experience, this changeability, is this a typical feature of Ommiccrronn?
But it is not only of Omicron. If you take into account even right from the beginning, 2 years before we had the coronavirus itself gives you a very challenging and changeable picture. Today the patient is better, but tomorrow he is not better. It can be a Pandora box. When you open, you have something new pathology, something new symptoms. You know, when the corona began, there was no initially loss of smell and loss of taste. It developed later on. I mean to say that the new set of symptoms is a very important aspect of the coronavirus. Maybe mutations there. Even with Omicron, we are also able to see new symptoms also. Patient may not be the same in the morning. In the evening, he may give you something different. For example, if you see your observation that during the treatment with a remedy, there are so many changes and intensity changes occur that we have to address them. I mean to say that I had to address with belladonna the headache. Usually it doesn't happen in seasonal flu and other acute symptoms, acute illnesses. So this is very characteristic of Omicron also.
Okay, so I even changed my recommendation to patients these days. If before I gave treatment for 24 hours, sometimes 48 hours in acute, I wanted to be in touch with my patients frequently. But now, with all these cases of Omicron, I prefer to be in touch sometimes even several times a day. So I changed my setting. They have to write me. Did you change your setting?
Yeah. My advice to all patients of corona, right from the beginning is to inform me whenever no symptoms will come up.
Oh.
And this was a very strict advice to them because you see, in acute cases, when the change is occurring, we have to be very adaptogenic and flexible to the need of the patient by application of the law of similars. Yeah. Yeah.
Great. And the last question about this changeability, did you mention that in Omicron, more cases than in previous variants has such scenarios like you start from one remedy, then another remedy comes, and then it appears once more the first remedy you start from.
It is possible. It is possible. But usually it all depends upon the stages of the illness also. I mean to say that you began, for example, with arsenic, then patient turn into bryonia. Then I found that in many of these cases, patient can turn either in phosphorus with flame and bloody discharge or with kali bichrome or kali iodome type. When you have the mucus, which becomes thick, yellow greenish and sticky. So sometimes you will find that patient can develop from arsenic album and can go in some other stages also. Sometimes you will find that the picture is very dizzy and drowsy and there is a fatigue, weariness, patient just want to lie down, no thirst, no appetite, patient doesn't want even water and speaking. So I found that gelsemium can be the beginning of the dose, usually in 1 m potency. And gelsemium is found to relieve very strong muscular pain of Omicron. If you take so much severe bone pains, which are also typical of Eupytorium purpureatum and gelsemium. So I think gelsemium also covers very strong bone pains in Omicron. So sometimes you will find that the patient can begin with gelsemium and can enter into bryonia also. So there are 3 cases I have on my record where the thirst appeared on the 3rd day with dryness and the cough, which is very essentially dry cough.
So you gave Breyonya.
Yes, I gave bryonia.
You
So
know,
it is very interesting how the travel occurs.
You have we have a another name for Breyonia. Till now it was Breyonia and then Dryonia because everything
Yes,
is dry.
yes.
And now these days we can say that it is Trionia. So it's Breyonia, Dryonia, and Trionia. It's 3rd day it appeared. But I'm coming back to the list. We are only in two first symptoms: running nose and headache.
Yeah. Then I can give you 3rd symptom, which is fatigue. Now the word fatigue, in homeopathy, you can use this word in relation with the weakness as such. I mean, fatigue is a medical word, but patient will explain to you that I feel weak. And for this weakness, arsenic album, then comes a very important group that is China group, especially China arsenicosum or China officinalis. Then the 3rd one for this weakness is muriatic acid. I have very excellent result of more than 10 cases where weakness is so prominent right from the beginning. You give arsenic, you give China, you give phosphorus, you interpolate a dose of tuberculinum, but weakness doesn't pass away. And I found muriaticum acidum as a very important remedy to deal with the weakness. Then Roman, there is a symptom of sneezing bouts, which was
Sorry,
not
before you continue, I would like to say that what we discussed before, gelsemium is one of the most important symptoms, remedies for fatigue. So we conclude fatigue in this way. And sorry. Just for the protocol.
Yeah, I understand. Yeah, just and with gelsemium, you will find a very strong symptom of Omicron, which is observed in UK study of 28% cases. That is dizziness, which is a strong symptom of gelsemium. Yeah.
I had the case of Gilzemium. I have a lot of cases of Gilzemium now. There's everybody has, but I saw a case when the state of Gilzemium started after emotional stress, after severe emotional stress. And we know in our Materia Medica, it's written there, elements from stress or strong emotions. And these days, unfortunately, so many people are going through these stress situations. So many people still related or connected to all mass media, to television and radio and so on. So you open television and radio and you can be strong, but if it showing to you, yes, every day, some moment your system maybe is not so strong, and this is what I saw, kind of falling of the capacity to hold a situation, and that's why after elements of stress, we see this fatigue and weakness and dizziness. And one patient this morning told me, I am so tired, I'm so weak. It took me 10 minutes to come from the bed, to wake, to go to the toilet, and then to come back. Usually it's few seconds. So this is a weakness.
And Roman, with Gelsemium, remember two things. First is, along with this anxiety is more of an apprehensive type. In Gelsemium, what is going to happen? What is going to happen? Whether I will succumb to this illness. A second point, which is very important, is with Gelsemium, you lose the confidence. This is very important. Gelsemium is a remedy with this muscular weariness causes a kind of a lameness. So the muscles become just like a paralysis. They do not go into movement as readily, swiftly. So this all produces a kind of a diffidence, lack of confidence. This is Gelsemium more.
I want to stress here that in the beginning, in the first variants of coronavirus, we saw a very strong appearance of Breyonya. Yeah. And then one of the explanation was that what is Breyonya? Breyonya is fear to lose business, fear to lose the capacity to make money, fear of financial stress, fear not to find a way to his own home, and all this stuff. So people were so anxious about what's going on and how I can cover and how I can be with this situation. It's interesting that nowadays, at the first place, I see, at least in my clinic, that Gelsemium is #1 remedy for this.
I admit.
And now you say that, one sentence, and now you said that it is lack of confidence.
Yeah.
And this is a dizziness, and you don't know where to walk.
Yeah. But you have to also understand the limitation of the Breyonya. In Omicron or even with Delta, once the throat irritation begins with a lot of tickling, rawness, and irritation in the throat, which induces the bouts of the cough. The cough is dry, but you will find that this tickling, which is very special about spongia, about hypersulfuricum, for example, about Drosera, for example, it is at this stage you will find that fever is okay, headache is okay, heaviness is better with Breyonya, but the cough with this irritation doesn't respond to Breyonya. So you must understand here that yes, Breyonya helps. Then 1-2 days, and then you will find that you have to move to the other remedy.
By the way, Ajit, I remember one of the first lessons in homeopathy. If acute started in throat, think about rootstocks. But I would like to say that it's a good idea, but it's not always right. and we have to stress it with that now, only now you said that if there is a tickling and because of this tickling, you have a cough, so you have to think about at least true stocks and at least sponget and at least heparin salt and some more remedies are here.
Yeah. And whenever you are thinking about HIPAA, you must think of rumex. They are like cousin brothers.
I remember your lecture about it. Okay, but let us come back to, we talked about fatigue and we close it as a symptom. Now the fourth symptom is
sneezing. Fourth symptom of Omicron, especially sneezing. And remember, sneezing is observed, according to one research, in 60% cases of Omicron. It's very interesting. So you have a seasonal flu, no? Sneezing and running nose and everything. And for sneezing, a very important remedy, which I found very useful, is our business partner, that is Nux vomica. And Nux vomica really helps considerably because this throat irritation is a very characteristic concomitant of Nux vomica. Patient is sleepless, patient has maddening type of headache, GIT disturbance is there, patient doesn't want to go for the closet, he doesn't pass ineffectual urging to stool, no thirst, but irritation in the throat. This totality matches very well with exposure to cold air. You know, if you study Omicron right from the Africa onwards in most parts of the world, this wave of Omicron is related definitively to winter. At least in India, there is a so much drop in the temperature in India these 15 days that during the temperature is around 20, 25, maybe 30 in some parts of India, and at night it is 5 or 10. So the system doesn't tally, doesn't adjust with the lowest temperature. And then you have a lot of seasonal flu-like condition. So I think Nux vomica could be a better in the relation with arsenic album because discharges of nodes in Nux vomica are also thin, watery, and profuse. Yeah.
Yesterday we discussed with our colleague, you know, Ina Dolgopolsky, these changes of temperature in India, for example, for 8-10 degree every several hours can cause severe states in the skin. Because of it, it could be cracks in skin, which is a climate reason for this. So one of my questions, even now, sorry to interrupt you, but even now, did you see different pictures of Omicron in India and different pictures of Omicron in other parts of the world?
Not in a major way, because I have been watching and I have patients of many countries. I found that Omicron has almost a universal set of symptoms. And the 14 symptoms which I am enumerating are usually present in all cases in the world. Maybe in intensity, they may be different. In evolution, they may be different. Yeah. And then we can come to a very important aspect of Omicron, that is soreness in the throat, sore throat. This sore throat, I think I discussed this issue with you, Roman, about Merck Sinaiticum. If you remember when I presented Delta.
I remember even first case of Merck Sinaiticum about 15 years, maybe even 17 years ago. Wonderful results with this remedy. But now at this stage, this is seldom so-called rare remedy. It could be more useful. Please tell about it.
Yeah, the sore throat is very characteristic of Omicron. It's like in the upper respiratory infection, this virus more causes windpipe inflammation. So you have a definite amount of swelling, stuck sensation, and tracheitis. And you have then bouts of coughing with very severe pain and rawness, with a bad taste in the mouth. And when this totality comes up, associated with chilliness, hypersulfuricum is found to be very useful remedy because it has also very early development of phlegm. Bryonia more for dryness and dry bouts of cough. But with hipar, there is a dry cough. You cough, and there is a phlegm, which is yellow greenish, maybe whitish, or maybe gelatinous. And then here you will find that hipar is very useful. Another remedy which I found very useful when the mucus is coming and it is increased, and that is Kali muriaticum. The Kali mur, I use it in Delta also, and I'm using it in Ommiccrronn also with very good results. In one homeopath case, I use Kali muriaticum 1 m every 3 hourly, and the case responded also to cough symptoms. We know Kali sulf, Kali bichrome, Kali iodome, we are using it more for the cough. But if you read the metaramedic of Kali mur, you will find that everyone has written about swelling, about white coated tongue, about the inflammation of secondary character in the throat, and then there is a coughing. So I open up the original Mater America and I found that Kali mur is also one of the very good remedies against bouts of cough. Yeah.
Ajit, here one comment and maybe even request to share your experience. We know triads in homeopathy. One of them is, for example, aconite, spongia, and heparsol.
Yeah.
Okay. And we know the development when we will change and where we will use for it.
Yeah. Yeah.
Did you see some triads which will be useful for Ommiccrronn specifically, or nothing specific if it starts?
Yeah. You see, when the evolution occurs, and if this evolution is also for a large number of people in the society, and if we find that one remedy is followed by another remedy, then the other remedy, then we can have a trio prescription, which could be used universally. Although our whole prescription is based on the concept of individualization. In this individualization, because of the mass effect of the pandemic, we could get the whole theme of a trio. Just the way in which you describe, for example, aconite, hipar, and spongia. I can also describe to you arsenic, bryonia, followed then by, in one case, I found this trio relates to the causticum. It is very interesting. Causticum has a lot of cough, lot of irritation in the throat, and causticum, like mercury, coughs 2 bouts. So this is very interesting. Yes, correct. So you will find causticum, and causticum has much to do with cold exposure to the air. And especially in a lady, when they have incontinence, along with the sneezing bout, along with the laughing, along with the coughing, causticum is a very, very good entry in the management of Ommiccrronn cases.
Who else has 2 bouts of cough? Causticum and
Mercury.
yeah, mercury, and who else? Causticum, mercury. You remember?
Yeah, there are some other remedies also. I
We
think
will see. We will see a rubric. It's interesting.
Yeah.
Mercury as well.
Yeah.
But you know, I saw in your cases so many times you asked, and if cough is appearing, so how many bouts of cough you have? And it was so interesting to see when you know something, when you're aware about it, then you can find it. You can see this appearance in front of you only when you're aware, of course.
Yeah. You see, Roman, this 2 times coughing is also covered by our phosphorus, pulsatilla, stannum metallicum, mercury, thuja. These are also some of the remedies against the 2 times coughing. It's a kind of a paroxysmal cough. So under the paroxysmal sudden coughing, you will find a host of remedies. Yeah. Okay. Then in 44% of cases, it is observed that the cough is persistent. It was persistent in Delta, so also in Omicron. I found that in persistent coughing associated with breathlessness in Delta, I found stannum metallicum very useful. And stannum has fibrosis also. So stannum is a very good entry, and it could be an entry in chronic coughing for days together coughing in Omicron cases.
Ajit, here I would like to ask you, will you prescribe stamm in Omicron cases when you have a persistent cough and breathlessness, but without this one of the famous symptoms of stamm, severe fatigue, and there is no very prominent weakness. If you will not see this weakness and fatigue, but you will have a persistent cough and breathlessness, what will give you confidence to prescribe stamm?
Usually, I don't go from Matera Medica to the patient. My contention is always that a remedy must cover patient's symptoms. And we must therefore go from patient to the remedy. A remedy is always a big one in the Matera Medica. It has host of symptoms. It has abundant symptomatology of thousands of cases, thousands of symptoms. So naturally, what you have in your mind you want to apply is not a good idea. If stannum covers the totality which the patient has, then you can give stannum. It is not a sine qua non. It is not essential that this data remedy must be covered. For example, epilepsy is a very strong feature of Buchimensky, but doesn't mean that in the absence of cannot be given in the absence of epilepsy. It is difficult. Otherwise, practice of homeopathy will be difficult to use. You cannot go from a remedy to the patient.
Yeah.
Yeah.
Very good, Mark. Very good, Mark.
Yeah.
Okay. So about cough, persistent cough, what other remedies you see there?
About persistence of the cough, I have also found Cuprum metallicum very useful. The patients are coughing, recurrent paroxysmal bouts of the cough. And they get exhausted with the cough, and the cough is a loud cough. What is very characteristic of cuprum in relation with spongia, for example, or even drosera, they have very loud cough, which could be comparable with stramonium. So when a patient cannot lie down because of the coughing, he has to sit up in bed. Once he lies down, there is a bout of the cough. Then cuprum can be a remedy of choice. Now about spongia and drosera, I have some remarks. I found that in Omicron related coughing, drosera has been found to be more useful to me than spongia. Now, one of the reasons which I found is that in many of these cases, patient might be having coughing, which is worse by lying down. As soon as the head touches the pillow, the cough bout begins. This is very characteristic of drosera. Second thing, I didn't find a very strong symptom of spongia that the patient awakens with a bout of cough and then there is a sense of suffocation. It is not a gasping like sambucus, but it's a kind of a bewildered feeling with suffocation. And patient literally has a kind of a breathing difficulty, which you come across more in spongia than in drosera. Probably this is the reason why spongia covers more cardiac asthma, cardiac cough, so-called, in congestive heart failure or left-sided ventricular failure of the heart. So to come to this understanding, I found very useful is Drosera as a tracheitis, tracheobronchitis, and patient cannot lie down with a lot of irritation in the throat, with hoarseness. Hyperspongia, carbovegetabilis, Drosera. These are the horse remedies. So there is a very good rubric, horse cough, and you will be astonished to see in the word 36 people, 36 percentage people of Omicron do have hoarseness of the voice. So how much trachea is affected, windpipe is affected, it is very interesting in Omicron. And I think this is a positive side to the humans because the infection stays on in the windpipe. It doesn't go down in the alveoli to cause their damage to the you see lungs and also to the heart. So we must pay our gratitude to Omicron coronavirus for not going deep in the lungs to cause pneumonia and damage. Yeah. So this is about hoarseness. Then there is a eighth very characteristic symptom, that is shivering and chilliness. Chilliness usually accompanies more than 30% cases in Omicron. That I found that they will develop chilliness right from the first day. Or fever is there and they start soon feeling chilliness. So usually, I believe more in succession of stages. There are 13 succession of stages, and I regard them as the individualistic pattern of exhibiting the fever totality. So I have found in Omicron especially, fever followed by chill or chill followed by fever. And in both of these patterns, you will find a host of remedies. This is a big rubric. Either you go from fever followed by chill or chill followed by heat. And I have found here a very useful remedy is hypersulfuricum. More the chilliness, more is hyper indicated because the whole picture with tracheitis, windpipe involvement, then with you will find coughing with a lot of irritation, flame, which is yellow greenish. This is hypersulfuricum. So chills and shivers are also covered very well with hypersulfuricum. Here, China officinalis and China arsenicum also found very useful to me in my dealing with Omicron cases. I fell in 2-3 cases with chilliness, with coughing, with all my remedies didn't work very well. Then clinically, in the absence of the thirst, I went for phosphorus. And with phosphorus 1 m being given repeatedly every 3 or 4 hours, even the whole picture subsided within 1 to 2 days. Yeah. And then comes the fever. Now, I must say you about fever in Omicron. In Delta, it was more intermittent fever. The fever touching to normal, then again appearing. In comparison to this in Omicron, you may have a continuous fever for initially 1 or 2 days. Then it may take on the intermittent type. So according to the stage, you have to take the proper rubric. For example, I had a case where there was intense heat, which is usually not a feature in COVID-19 with all the variants. But in my case, it was there. And the temperature was 103 degree. That is almost, it was more than 39.8. So the case responded very nicely to ferrum phosphoricum 1 m being given repeatedly. In Delta, I use ferrum phos very, very frequently in the initial phase of the pneumonia with high degree temperature. Comparatively in Omicron, I found that ferrum phosphoricum is not very useful because the fever is not high. That particular redness of the whole system and the skin becomes very flush and all these pneumonia presentation is very, very rare with Omicron. Yeah. Then dizziness. About dizziness, I told you about gelsemium and about Breyonya also and muriaticum acidum also. Then comes brain fog. This is something which we have to understand. In There are two variations of brain fog in Omicron. First, during the acute illness, they don't want to think, they are confused, they don't want to apply any mental exertion because this is a kind of a fatigue of the brain. And I have found here a very useful remedy is Kali phosphoricum. If you read Kali phosphoricum, you will find that it can be used in acute illness of influenza with prominent weakness also. So if the brain fog is associated with weakness, patient doesn't want to do any kind of mental exertion, you must think of this particular remedy, caliphosphoricum. The remedy which can be competed with this is phosphoricum acidum with brain fatigue, but it will come more at a later stage when the Omicron storm is over and the patient is now in the remnant stage of defective recuperation, of convalescence which is delayed. Fatigue, patient doesn't want to do anything and he has become indifferent. So acid fast can be a remedy of choice. And then comes in 23% cases, muscle pain. I must tell you about this. Muscle pain is a very strong symptom of Omicron more in comparison to Delta. Where are the muscles pain? First, in the thoracic region, in the back region, and in the lumbar region. Mostly in the lumbar region. In some of these cases, I found, especially from Israel, lumbosacral region is more painful in comparison to Indian cases. In India, I found more lumbar pains very severe. So what are the symptoms? Which is very interesting. Patient becomes locked. He cannot move. Even a slight motion, even turning in bed causes very severe aggravation. So in one case, when I use Rastox, very useful. In another case, Rastox not useful, Breyonya not useful. In one case, I use causticum with good results. In another case, a very interesting remedy which I use, and that was oxalic acid. You know, it is very interesting. Oxalic acid is a remedy of pains. Long back, there is a very interesting case of oxalic acid being presented by George Vitulkas. It was a case of, multiple sclerosis. The case was very vividly described by Vitulka sir. And I found that this remedy needs a very wider application in acute as well as chronic cases. And in our absolute remedical next volume, we have included oxalicum acidum. It's a pain remedy.
Very good. It's very good.
Yeah.
Of course, oxalic acidum is a cardiac remedy, and it's many. This remedy covers a lot of things.
Yeah.
But this muscle, I'm coming back to muscle pain.
Yeah.
Muscle pains. So you saw causticum, Breyonya, Rastox. I have a few cases with Rustox and gelsemium, usually. Do you have some other remedies here to be?
Yes, I can give you. Yeah, I can give you a very important remedy for muscle pain, more of a tearing type during fever. This is arsenic album. Very few people focus upon arsenic album in terms of muscle pain. When the muscle pain is very severe and of a tearing type, this is very important. Arsenic album is a drug of choice. Then I have very good results. On the fourth, fifth day, the muscle pain is not diminishing and patient has fatigue. Then the remedy could be lycopodium. And lycopodium, I have found very useful in Omicron cases. You have given arsenic, you have given belladonna, Breyonya, Eupyturium purpuratum for muscle pain. But anyhow, the system doesn't recuperate. There is a lingering response. Then you must think of lycopodium as a remedy of choice. This is the issue with Lycopodium. And no one should also forget Nux vomica. Nux vomica has also got a lot of pains because Nux is nothing but a kind of a painful remedy because it is like a strychnine. So you will always find there is a more excitation of the nerve fibers. And then you have the prostaglandin synthesis leading to the pain issue. So Nux with GIT disturbances and very severe backache. So Nux is a very good entry, especially Nux has a symptom turning in bed aggravates the backache. Yeah, yeah.
Not to forget here Eupatoran perfoliatum, our classic remedy for
yes, correct.
And not to forget here all remedies from composite family,
Yeah,
Arnica,
Arnica montana.
Arnica montana, and Calendula, and Belispirenis, and many others from this group.
And there is one more remedy, Roman, which is very useful for pain in chest during Omicron with coughing and all these things. There is nothing wrong with the heart or with the lungs, but there is a definitive amount of pectoral muscle inflammation, like costochondritis. Ranunculus bulbosum in one case did the wonder, you see. Within few hours, the pain disappeared.
Great. Wow. Yeah. Very interesting. This is an area of ranunculus bulbosus. Usually, we know hepatic issues in this intercostal herpes. Very interesting, Ajit. Ranunculus bulbosus to take into consideration.
Yeah. Now you see, there is a one more symptom which has been also observed is loss of smell. Loss of smell is found to be useful symptom in both Delta as well as in Omicron. Loss of taste and smell combined together was more in Delta, whereas in Omicron you get more loss of smell. And we have a long list of symptoms for this, right from you see antimonium tartaricum, arsenic, belladonna. Then we have hypersulfuricum, hyoscyamus, kali carbonicum, kali iodum. So these common remedies which we prescribe for flu cases, you will find all of them do have the loss of smell. Especially if you take hypersulfuricum, there is a chilliness, there is a flame which is occurring, there is a lot of irritation and coughing, and there is a loss of smell. A patient is hoarse in talking. You will find HIPAR is extremely useful. And very typical about HIPAR is its burning character. HIPAR has been presented very nicely by Jeremy Sher in his syphilis book, one of the very favorite books of mine, where he presented the concept of the fire, the insulation. So the theme is that you have a very severe burning and sticking type of pain in the throat region, and then with characteristic desire for warm and better by warm drinks. So this totality matches well with hypersulfuricum. And then we have the chest pain, which I dealt with already. About chest pain, I have found also the Breyonya is a very important remedy in relation with kali carbonicum and ranunculus bulbosum. In one case, ranunculus didn't work. Then I took the whole totality and I found that the case matches very well with kali carbonicum with very good results. So this is all about the 14 remedies, 14 symptoms, and the related our armamentarium to deal with the 14 symptoms. If we make a good totality of them, if we make a good repertorization of the cases, I think we can do a lot of justice to Omicron cases. And I already told you, really a very wide field for homeopathy is now open.
Yeah, for sure. And then the results, we can see these results sometimes in several minutes, sometimes in several hours. But
yes.
Doesn't matter.
And there is less fear of hospitalization. There is less fear of resistance by ICU people. there is less of feeling to the inferiority to the homeopaths that you are not allowed in the hospital with Omicron cases.
Yeah.
So we are at the upper age.
Yeah, Ajit, I would like to, I mentioned here a few questions about this list. So shortly, let us go through these questions. Loss of smell. We know this rubric, and we have some favorites from this. Did you see some use of zincum or zincum metallicum or other salts of zincum in Omicron with loss of smell?
No, no. I have found Ginkam useful more in Delta cases. In Omicron, I found that this is not a long-lasting symptom. Usually, 3 or 4th day, the smell returns back. I think one of the reasons is that the nerve endings are blocked because of the virus, and there is a production of the cough and flame. So it's like a block. It is like a nerve ending is blocked. So you have a loss of smell based on nerve irritation, based on nerve pathology. This is Ginkam more. So I will prefer phosphorus more in Omicron related loss of smell than Ginkam, because this pathology of Ginkam is a little bit a different one. Ginkam has a pathology related to the nerve pathology. When the nerve fibers are being irritated and there is a kind of a degeneration which occurs, then Ginkgum is a remedy of choice more. Phosphorus goes in both ways. It has a tissue degeneration, it has flame, it has nerve. So phosphorus will be more useful. If at all you find that you have given the set of remedies like gelsemium, hyoscyamus, arsenic album, and they are not very useful, HIPAR, and then you can move to phosphorus. This is what I think. Yeah.
Okay, very good, very nice addition. Now, about sneezing, we talked about sneezing, and you mentioned Nux vomica.
Yeah.
Of course, if we open repertory and we'll see in sneezing so many remedies. What about other remedies like Sabadilla, like Pulsatilla, like others?
Yeah. Tabardilla is more for allergic type of presentation. I mean, rather than the fever totality is less with Sabadilla. Sabadilla is basically a remedy where you will find pollen aggravation, flower aggravation, dust aggravation, with severe bouts of sneezing associated with itching in the nostrils and itching in the ears and in the palate. So if this combination is present for Sabadilla, it can be a remedy of choice, but usually allergic manifestations are less in Omicron cases because it's an infective origin disorder. The second thing, Sabadilla is not only an acute remedy. I have 3 cases of chronic rhinitis which I treated exclusively with chronic constitutional Sabadilla. And one of the reasons why they started having rhinitis was suppression of the anger. Sabadilla is an angry remedy, like chamomilla, like anacardium, like kali carbonicum, which is having suppression. So you have a atmosphere at home, someone humiliates you, you have the suppressor of anger, and then you develop this grief being expressed through the sneezing bouts, through the allergic manifestations. So this is very typical of the Sabadilla. And when the patient is violently furious, there is a modality in Sabadilla, feels better by applying ice to the head. He literally keeps the head below the ice cold water, and then he finds the relief.
In our school, I suggest when we study Sabadilla to take a few pieces of ice, and then we started to learn Sabadilla. They put ice here, and we say Sabadilla, Sabadilla, Sabadilla. But this is not so frequent remedy for Omicron, so we will forget about Sabadilla now. And the last question about Omicron, Ajit. We know about this movement post-COVID treatment. So first of all, your main recommendations about post-COVID treatment with homeopathy, like other homeopaths usually use carbo vegetabilis and sulfur and calicarbonicum and tuberculinum and phosphorus and many other remedies. So this is the first question in general. And the second question, the difference between post-COVID in Delta and previous variants and post-COVID with Omicron variant.
I think about the post-COVID complications in Omicron, I think they are significantly less in comparison to Delta.
This is good news. These are good
Very
news.
good, very good news. And I think this is I will say, Corona goddess grace over the humanity. This is basically because, okay, I understand that today there are two types of variants which are going on, Delta plus Omicron. It doesn't mean that now Delta is less and Delta is totally annihilated and it is being replaced by Omicron. I don't think. I think that parallel, we have two infections which are going on in most part of the world. The whole issue is that if it is a Delta, it is really a matter of concern about post-COVID. I already gave a big seminar and you allowed me to write a almost 20 pages, you see, article over post-COVID management with homeopathy. So about Omicron and post-COVID, I think one of the very important remedies which could be instituted is carbo vegetabilis. Because in Omicron, you have tracheitis, you have hoarseness, and I have found that patient has no power even to cough, no power to talk. So much the vocal cord has become weak. And you know, this is characteristic of carbo vegetabilis. If you read the original proving of carbo veg, you will find that the sensation is that the voice has become so weak. He has to exert a lot to talk. And I have found many patients of post-Omicron hoarseness with coughing that they cough from the abdomen because they use the abdominal muscle, they use the stomach, and they use the accessory muscles also. Then they are able to cough. They are so weak. And carbo vegetabilis really recuperates them and gives them the greatest tonic like sorinum. Yeah.
So you use sorinum as well as a tonic?
Yes, I use sorinum. I use sorinum more than carbo vegetabilis in post-influenza weakness.
Mm.
Yeah, yeah. This is very interesting. I think that the per se remedy for post-influenzal complications, especially weakness in chilly subjects, is sorinum. Yeah.
So interesting. So we know that post-influence cough, for example, it will be for sanguinaria. Post-Omicron or COVID, doesn't matter, weakness will go for carbo vegetables, but we have to think about sorinum. And the last question, what about tuberculinum? You're famous, you're a good friend tuberculinum. What about tuberculinum?
I have to say that, okay, about the Delta variant, when we saw that arsenic 30, which was recommended by Ayush in India, then the stage came when we find that even after arsenic 30, many cases are coming down with Delta variant. Then my study gave me tuberculinum. If now I understand tuberculinum as a remedy in Omicron, I have to take a one step behind in pushing tuberculinum. Why, I will tell you. Because Omicron doesn't give you the whole picture like tuberculinum, where there is a septicemia, where there is a necrosis, where there is a thrombi, where there is a bleeding, intravascular disseminated coagulation. All these very strong pathologies are absent, almost absent in Omicron. So I think it is wrong to push tuberculinum in a manner which I was pushing in the past. And so now, if I study the whole totality of Omicron, still my first choice is arsenic alba. I will tell you why. Because the illness begins with thin, watery, profuse catarrh, with a lot of sneezing, with a lot of anxiety and restlessness and thirst, which is increased. This totality in the beginning stage matches very well with arsenic. Second thing, if you take the weakness, which is post Omicron in many cases, it also resembles very well arsenic album. Third, I have found some cases of Omicron also presenting diarrhea, where the patient has to hurry to closet with a lot of weakness and offensive stools. This also very well is covered by arsenic album. So I maintain that even with Omicron, my first drug of choice is arsenic album as a preventive. Maybe once the treatment begins, according to the stages, you may need to change the remedy. But prophylaxis for Omicron has to be arsenic album, and I will like to give it in all prone cases because transmissibility of Omicron is much higher to go for weekly one dose of arsenic 1 m.
And
Yeah.
here, Ajit, here, question. We are almost 2 years in all this so-called epidemic. We don't know if this is epidemic, pandemic, we don't know. But anyhow, from the beginning, you mentioned arsenicum album as many others as a prophylactic remedy. And many homeopaths all around the world use arsenicum album as a prophylactic, and many people use this remedy. I know that millions of doses of arsenicum album were spread in India only. Now, my question, I will translate and I will say you now the question of many, many people who are not homeopaths and who are not so related to this data. So you suggest for 2 years to take weekly arsenicum album in such high potency 1 m. Is it right? And if not, when to stop? And if yes, how to take it? Because, you know, in general, arsenicum album weekly 1 m, but when to start, when to stop? Is it necessary to make breaks? Please.
You see that giving arsenic album 1 m every week for 2 years is not the theme with prophylaxis. You cannot push a remedy so long under the use of preventive. The whole issue is that if you take my book on homeopathic COVID scope, I have given several categories of the prescription of the prophylaxis. You know, when the whole issue about prophylaxis began and the spread of the coronavirus began, there were 3 stages which were developed by the government, by the respective governments: orange, red, and I think one more color, red, and something like some other color. The whole issue is that they divided the human transmission according to the density, human density. So I mean to say that when Omicron has the greatest transmissibility in one area, you can repeat it. If it is not, so much repetition is not needed. So it all depends upon the transmissibility, the virulence, and how many people are getting daily affected. This statistical study has to be attached with the repetitive doses of homeopathic prophylaxis. This is the idea. The idea is not that I say that you repeat once every week, you repeat every 15 days. It must be attached with the current wave. It must have attached with transmissibility in the human density. This is the idea.
I understand this idea, Ajit, but we are homeopaths and we don't have an approach to this data. And what you will recommend to people from Facebook, from Instagram, from even social, other social media, and from newspapers?
Yeah, I will. The first thing is that if there is a one patient of Omicron in your home, one patient, all family members, maybe 5 or 10 or what maybe, are going to get affected. Naturally now, you have to repeat daily repetition. In such cases, I have repeated arsenic album 200 daily, one dose at bedtime for 5 days or for 7 days with excellent results, because there is one person near you who can give you the Omicron. So the best way to repeat daily for a few days to get the preventive aspect, the action of the homeopathic remedy. Otherwise, in those areas where in an apartment, you will find the corona patients are there, 5 or 6 patients in an apartment of 100 people are there. And it is impossible that isolation will be 100%. And this infection is also airborne, because this is a very debatable question. Some say without human transmission, they cannot spread. Some scientists say no, human transmission is even not needed. This is something debatable. I don't want to go into the debate of
Yeah.
this. Then in such cases, you have to give at least once or twice every week. Arsenic
200
album.
or 1 200.
200, 200, yeah. But for health workers, for example, the health worker may be a doctor, maybe a nurse, maybe a ward boy in a hospital, maybe the medical staff. Then they are exposed to the virus daily. I will repeat 1 m daily, one dose for few days. I haven't come across any proving symptoms so far. Within the span of more than 2 years, I might have given arsenic album repeatedly to thousands of people. I have not found anyone coming down with any symptoms.
So just to make clear here, if somebody is a health worker and this is his job, he every day or most days of the week, he is meeting people and he is in touch with people and so on. And he's working for 20 years, not for 2 years. So in the last 2 years, he started and maybe took several doses of arsenic album, and we see that this whole story is going on from this day. From days they will see our video. What do you recommend to these people who are in touch with other ill people every day?
The whole issue is that, you see, prevention is always better than cure. You don't know the behavior of the corona in future. And as a health worker, you are at a risk. Why not to take arsenic daily? And if at all some proving symptoms occur, stop it. You have every reason to stop it. And homeopathy, by that way, being micro doses, infinitesimal doses, are not toxic because they are not crude remedies. So don't frighten yourself that we are taking arsenic album. No, it is beyond Avogadro number. It is infinitesimal. I don't think it will cause damage because it is not crude. Second thing very important is that, as far as arsenic album is concerned, Ayush gave it to more than, 15 million people in India. They collated the information, the database is so vast that it took more than 1.5 years to process the data. 40 people were 24 hours working at central government undertaking. And the result are 81% according to the research paper of Ayush. So do you want to neglect this data only because allopaths don't want to publish it? And are we interested in homeopathy, allopathy, Ayurveda, or ailing humanity today? Every science has its scope, has some limitation. To say that homeopathy has no scope is a big injustice over this greatest scientific method. Recently, I got a very good paper, What is Scientific Method? And he has given a very good example how the scientific methodology in homeopathy is the most scientific way of presenting homeopathy to the science, to the profession. And science is something which is open. Science is one where you are ready to experiment in a novel way. You are in acceptance mode. When you say homeopathy is a placebo, you negate the whole concept of the infinitesimal. You negate the concept of water memory. You negate the concept of nano technology and nanoscience. Why? Have you studied homeopathy deeply? 250 years is a big period, not a small period. You know, homeopathy today is the largest alternative therapy in the world, which has $1 billion business every year. So do you want to negate it? Only because you are ignorant and egoistic? Ignorance and egoism are greatest enemies of science. And I think now with Omicron now, we have such a wide platform to present homeopathy now. We must push homeopathy in every home in the world. And this movement you are talking about, Roman, must be a part of the homeopath. This is the proper time to inject homeopathy, to project homeopathy, to infuse homeopathy at every home. I always say homeopathy is related to home, not only to homeo love similars.
So I hope this small conversation will help us to bring homeopathy to every home,
Yeah,
which is open for our
yeah,
information, for our
yeah,
desire to help,
yeah,
for our readiness to help, and
yeah,
for our experience of these last 2 years. We have a quite big experience from all around the world. Homeopaths can
correct.
share their experience, and we will do it in our way.
Yes.
Dr. Ajit Kulkarni, thank you so much for this conversation. We will be see you in next programs. Thank you very much.
Yeah. Okay. Yes. Yes. Take care.